Greetings. This is Justin Allen, the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up. Our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system, and frankly, screw that. I'm sick of it, and it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take the measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked to the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help the nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode. Hello, everyone. Today we'll be talking to Nick, who is a family and acute care nurse practitioner. Currently, he is working full-time as a hospitalist and as a director for a clinical education program. He recently started an integrative medicine practice that is scheduled to open in about a month. He will be offering a variety of services, including functional medicine, hormone replacement therapy, weight loss, and more. He's needing assistance with how to practically operate the business and how to structure pricing and memberships for his programs. Hey, Nick, how are you?
I'm good. How are you, sir?
I'm doing good. Thanks for hopping on here. So tell us a little bit about yourself. So you've been a hospitalist and you are just getting ready to start an integrative medicine practice. So tell us a little bit about yourself.
Yeah. So I've been in practice in mid-level for 22 years. Started out in family practice after being an open ICU recovery nurse, kind of probably a typical journey of most nurses before they become mid-levels or other advanced practice nurses. And then I did rural family medicine in South Mississippi for many years, and then I went back and finished an acute care program and joined a hospitalist group when I moved to Dallas. I've been in the hospital medicine space as a mid-level hospitalist for many years. My journey into functional integrated medicine began about 8 years ago, 8 or 9 years ago, where I got did training through the Institute of Functional Medicine. Went through their program. Then I got a board certification through A4M, and then did their fellowship program, all of which was great education, wonderful education, grew me tremendously. But I really was lacking just the practical application to this in the office. So I had all that stuff swirling around my head, but in terms of actually generating income and revenue and making a successful profit out of doing something like that, I just really did not know how to do that. So I just continued to train. And so now I'm at the point where I'm ready to, start a practice. I, got a website built and, so kind of putting those pieces together. So now I'm at the point where I'm getting ready to launch the practice, but really am struggling with pricing, particularly how to market and deliver the services of functional medicine in terms of packages, right? Just like you, I'm sure as a clinician, you've been used to going from room to room, patient to patient for years and years. I know that you're an experienced clinician. Same situation on my end. So I had to switch my thinking. So if I'm going to treat hypertension or treat a gastrointestinal problem, it's not a one-off. It's a package. It's a journey that you take. It's an 8-month deal. It's going to cost this much money. It's kind of what I'm hearing from other functional medicine providers, and I kind of had to, change my thinking. That's kind of the switch I'm making to understand how that looks, financially. If that makes sense.
Sure. Okay. So this practice is going to be an integrative medicine practice where you're going to predominantly be doing functional medicine, but you're also going to be doing some of the niche services as well, like weight loss, hormone replacement therapy, et cetera, right?
Yeah. Yes, sir. That's
Yeah.
right.
Okay. What do you want your focus to be in this practice? Like, what do you feel like it's going to be the main thing that's going to, separate you from everyone else? Like, what is it that you want to do predominantly? I mean, you got weight loss, you got hormone replacement therapy, all these things. They're all complementary services, right? But what is it? What is it that you want to focus on?
Yeah, that's kind of a loaded question, only because I am really fascinated with cancer care. I'm actually right now in the middle of the metabolic approach to cancer. It's a integrative oncology program run by Dr. Nasha Williams, a naturopathic physician up there in Portland. There's physicians mid levels in this program. It's fascinating. It's something that I'm really getting interested in. That's a future thing. That's really what where my interest is evolving into. But right now, what I do every day in terms of niche services is hormone replacement therapy. Medical weight loss peptides. I do that Monday through Friday. That's like second nature to me. So probably that niche of patients right now is what I'm really interested in. I don't want to leave the functional medicine piece behind it because it's so huge. It kind of it's the in my mind it's what undergirds the way I look at a patient through a functional medicine lens. So I'm not trying to talk around your question, but to be it's the answer is as straight as I can. Probably these niche services is probably where I would see myself starting, and then evolving from there.
Okay, so you're going to be cash based, I'm assuming.
All cash, yes, sir.
Okay, cash based. This is going to be a brick and mortar practice.
Brick and mortar in 30 to 60 days, virtual practice as soon as possible. So
yeah, okay. Your area, what kind of competition are we looking at here?
Texas is huge for hormone replacement therapy. I don't know a lot of practices in the area. I have a really good friend that just purchased an enormous fitness center, and there was a physician that had an age management medicine practice, kind of annex to that center. That group left because it was under different ownership. He purchased the whole thing. He offered me that same space and said, they used to be in here. Do you want to move in here? And we got an instant population of hundreds of men and women. So,
oh shoot! So you're starting this on the right footing. It sounds like. So you got.
So I'm kind of a little nervous. So yeah. Moving in.
Okay.
So.
Okay. Perfect. So it sounds like you got an ideal space. I'm assuming this fitness center is probably on a main road or something. Are you going to have an opportunity to put like a sign out too for people just driving by?
Well, the way that they were advertising their services is within the fitness center. They had huge, color kind of drop down, what you call those things? They're advertisements that they hang on the wall, but really nicely done.
Right, right. But are you going to have any opportunity to advertise outside of that? Are you going to be able to have like a sign on the road?
Oh, he wouldn't mind. Yeah,
he wouldn't care. Well, perfect. Okay, so you can go out there and put a big old 6x6 sign if you wanted to. Okay, it sounds like you're in a pretty good spot here. So, okay, so think to yourself here predominantly, you got this fitness center, right? You got all these people coming in who are going to want specific things to help them be more fit, right? To help optimize their health overall. So people are going there to try to lose weight, right? So weight loss is a no-brainer. You got people who might be at a little bit higher level of fitness. I'm 40 years old and I have a pretty high level of fitness for my age. And as I'm getting older, I'm starting to notice that, I'm more injury prone, my recovery has decreased, et cetera. So you got people like me there who are going to want peptides, hormone replacement therapy, those sorts of things. So weight loss hormone replacement therapy for this those are two absolute no-brainers. I think that's probably going to be the predominant source of your business more than likely there. So you need to really focus in on those things, right? The functional medicine piece of it, that's just functional medicine is just a way, a way to practice, right? And, hormone replacement therapy fits right into that as well. Weight loss, maybe not as much, but it's just a service line too, that if you have people there who are wanting primary care from a more functional medicine base, then they're there, right?
Yeah, absolutely.
Yeah. So it sounds like you're in a really good position. So if it was me, that is what I would be focusing in on. The name of your practice includes integrative medicine into it. Is that what you're doing?
Yes. Yes.
Yeah. Okay. So I would make sure to also have a subheading with that as well, so people know what it is that you're doing. So they might see your practice, whatever, in integrative medicine clinic, but make sure that underneath that you have like hormone replacement therapy, weight loss, functional medicine or something. Okay. That way people know what it is that you do. All
Would
right.
would you be able to, may I ask you to, would you be able, would it be appropriate to ask you to, to look at my website and just comment on it? Or is that,
Yeah, for sure. Go ahead and put it in the chat here, unless you want everyone to know what it is.
it's functional and integrative medicine.com. All one word. Functional and integrative medicine.com.
Okay, cool. Well, expect once this is published to get a big influx. Well, I can't believe you were able to get this domain name, honestly. Kind of lengthy, but it'll work. So the website, so I'm just going to be basically speaking with, out loud here, because people have no idea what's going on here. So front page is a nice little video, people working out and stuff. First things that you say here are, do you feel like you need to have a medical expert listen to you? Have you be heard? You struggle with chronic health issues? Are you struggling with the inability to lose weight? Have you thought about whether or not hormone replacement therapy is right for you? So you have like all these questions here, which is, basically identifying a problem, correct? So, yeah. So if you're going to focus in on weight loss and hormone replacement therapy, you basically just gave your domain name out of here. So I'm just going to say the name of your practice. Is that okay?
Absolutely. Yes, sir.
Yeah. Okay. So it says, welcome to Apex Integrative Medicine. So underneath this, I would get rid of all these questions and I would just basically put the services in bold, medical weight loss. Underneath that, put semaglutide, tirzepatide, whatever. Hormone replacement therapy for men, testosterone replacement therapy, women, testosterone replacement therapy, estrogen, etc. Peptides, help your recovery, tesamorelin, blah, 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 whatever. Just boom, 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 boom. Put it right there so people land on this website know immediately what it is that you're doing. Okay. And then underneath that, has your about us, which has, a picture. Is this a picture of you?
Yeah, well, it just says about or meet me.
About us. Yeah. Is that picture of you on there, or is it just some random person?
Yellow shirt, bald headed guy.
Yeah, that's you. Okay. Perfect, man. You look healthy. You look, you look vibrant. Good. Okay. So yeah, no, that's fine. I would put that below our services though. Okay.
Okay.
Yeah. And so have all your services listed there: functional medicine, medical weight loss, hormone replacement therapy, etc. Okay. And then you have these, these new episodes here where you're talking about various things. That's great. It shows that you're, an expert at this sort of a thing. So yeah, your homepage looks pretty good. I would say that, change those things right there. Because basically the thing you got to remember is that you want people to land on this website and to know instantly what it is that you do. Okay. Do not give people a job to figure it out. Like, I can't stress that enough.
Is that true? I had a guy, I had a previous website that I just shut down because it was just garbage. And he told me, he said, you have 2 seconds to capture the interest of somebody jumping on their website. And
100%.
Yeah. So
2 seconds, 3 seconds. Okay. I mean, you're guilty of this just as much as I am. Like, you click on something from Facebook or whatever. If it doesn't grab your attention within, me personally, I'll at least give it 5 or 10 seconds. You know what I mean? But if I can't figure out what the hell it is that you're doing or what you're selling or what it is, I click off of it. I've got time to figure this out. You know what I mean? So make sure you grab their attention. And by that, you say, welcome to Apex Integrative Medicine, your partner with your weight loss and health optimization journey. Boom. And then underneath it, list those services as fast as possible. Okay. That way people know what it is that you do. And then the services, each one of these little pages that you have, like telehealth, get rid of it. Okay. You don't have to put telehealth there as a service. I mean, anymore people expect telemedicine. You know what I mean? So you just type that into, the services that you offer. All right. But you have like clinical peptide therapy, hormone replacement therapy, functional medicine, medical weight loss, integrative medicine. All those things sound great. Functional medicine and integrative medicine, it kind of sounds a little bit redundant there. So maybe pick one or the other, or put functional and integrative medicine. Okay. But like on your services page, so I'm clicking on clinical peptide therapy now. So the service page, talks about clinical peptides, the benefits of it, et cetera, boost energy. There's a question and answer thing. That sounds good. Make sure you list the peptides that you're offering, because there are going to be people who click on this and be like, does this guy offer BPC? Does this guy offer Sermorelin? Does this guy offer Tesamorelin? Okay. List those things. All right. Be as specific as you possibly can with these things. List it there, because if not, people aren't going to know what it is that you're doing. And then I clicked on your hormone replacement therapy service page. Everything here looks pretty good. An introduction to what it is, benefits looks good, but I'd be like, male hormone replacement therapy, click here. Female hormone replacement therapy, click here. Then have 2 separate pages for each one, and then list the benefits of it. Okay. So always, the service pages aren't as important as that home page, that landing page, because that's where you need to grab the attention. Okay. And, you have buttons all over your website, get in touch, call us, et cetera. So that's all good. So honestly, man, your website looks pretty good overall. Did you build this yourself?
No, Growth 99 is the group.
Okay. Right. It looks good overall. I mean, it's, if you paid for it, I hope you didn't pay a lot for it, because it looks good, but if a professional did this, I feel like they probably could have did a little bit better of a job. But
they're still working on it. It's
still working on it. Okay. So that's what I would do if I was you. Okay.
Yeah.
Overall, though, looks good.
I have a meeting with them every week. They meet with me, the development team. They ask me for suggestions, and so getting expert input from you is golden, because I have a meeting with them on Friday, and I'm going to come to them everything that you're recommending here. So that's great.
So my recommendation also for this is that if you have someone else building a website for you, make sure you get the login information. Okay. Right. Make sure you can log into the WordPress or whatever it is that they're using to build this, and make sure that you can get in there and edit and put some wording in there yourself. Okay. Like, website designers aren't really content creators. They just build websites, make it look pretty.
Absolutely. That's I'm learning that.
Yeah. You as the business owner, it's your job to provide the content there. Okay. So make sure that you can get in there and, change some wording and stuff like that. Okay. But yeah, overall, it looks pretty good, man. I think it'll work. So make sure that your Google business listing is tied to this. All right. And make sure your Google business listing says Apex Integrative Medicine, weight loss, hormone replacement therapy, integrative medicine, functional medicine. Okay.
Perfect. Yes, sir. Absolutely.
Yeah. Make sure you put that on your Google business listing, because people need to know what it is that you do. But it sounds like you're going to have a lot of foot traffic here, because you're next to this large fitness center. So if they allow you to get in there and put advertisements, make sure you offer some discounts too. Are you a member of blah, blah, blah fitness center? 10% off, 20% off your first month of therapy, whatever. Come visit us for a thorough lab work evaluation. Are you tired, not recovering well? Come check us out for hormone replacement therapy. Your T might be low. Struggling to lose weight? Are you out here? Are you on this treadmill for 45 minutes a day, eating like a rabbit, but not losing weight? Come check us out for Ozempic, semaglutide, whatever it is. Okay. That's how you're going to draw people into your practice.
Okay. Kind of put flyers out there in the fitness center. He doesn't care what the heck I do. So,
man, I would put not even as flyers. I'd put posters and make them nice. You know what I mean? Grab their attention. I wouldn't just print something off on a printer and go up there and tack it in. I'd see if I can get some frame posters and go over, hormone replacement therapy, the benefits, weight loss, the benefits, what we offer. Just put those around, put them in the restroom, put them, on walls. If they have TVs mounted in front of the treadmills and stuff, see if you can get like a little bit of a little commercial or something that you can post on there, just something real brief.
How about meetings there? Like, offer, educational,
you could. I wouldn't expect it to be a hit though.
Okay.
Yeah. So that's what I would do. And then just advertise the hell out of it. See if you can get like one of those little A-frame, boards that sit on the ground and put it right outside there. Check out blah, 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 Apex Integrative Medicine if you're needing help optimizing your health, hormone replacement therapy, et cetera. Like I would be trying to milk that resource to the max. Okay. You got to remember, it takes on average someone to see your ad 8 to 10 times before they decide to actually call or go to your website or actually, become a paying customer. That's how many times it takes. So every single time these people are going to the gym, they need to see your ad.
And the demographic of the facility, in addition to a sign outside, like this other medical group, that had their practice in there. They, again, they had these things posted on a couple of the walls, real big, real professional. And I don't know how do you explain it. It's a very professionally done poster, but not made out of poster paper. It's like a roll down thing. You know what I'm saying?
Right.
So they had that in one in big, two or three of them in each large center. Of the fitness center. There's also a huge BJJ gym that's a part of that still there. So they had a one there, and so.
What happened to all those patients is my question.
I don't know. So the owner that owned the gym, I didn't mention the gym or anything else, so I can just tell you generalities. He had marital trouble. They divorced, and he was dating the physician, the girl that owned the practice, medical doctor, and that didn't work out. So he took her practice and left.
Wow. Okay. Well. Like, did they move somewhere? Did the patients go along with them, or are these patients are they just all shred of luck? What's going on?
I don't know. That's a good question. That's a question I need to answer. That answer that he didn't. I didn't ask him that question. I don't think he knows. I don't know how to actually get get that information. I guess I can just look her up, call her office.
Yeah, look her up, call the office, see kind of what happened. Because if all those patients, if she just left town or whatever, you might have a lot of patients sitting there really desperate to continue treatment, So that is something that would be worth your time to look into.
Okay.
Yeah. So, but that with your Google business listing, man, because people who are wanting these services, I feel like a broken record sometimes, but the people who are wanting these services are looking for these services. So you got to make yourself easily found. You got some YouTube videos, think about maybe having a little article section on your website where you're talking about men's health, hormone replacement therapy, weight loss, the benefits of semaglutide, et cetera, et cetera, et cetera. Put those on your website. It'll help increase your search engine optimization so people will be able to easily find you. Okay. So do that. Google business listing, take advantage of the resources there at the gym. I would leave it at that for now. I probably would not spend any money advertising this outside of maybe some Google search ads, okay? Because people in your area are going to be looking for this, semaglutide clinic near me, weight loss clinic near me, et cetera. So you can do some Google search ads. I maybe, $500 a month on that or something. Outside of that, I wouldn't spend a dime on marketing, and I would just try to take advantage of the walk-in traffic you got, because you have an opportunity here where you could potentially build a very profitable practice and not spend a dime on marketing just because of your location.
Right. Exactly.
Yeah. And get a good sign built and put it on that road, dude. Like my men's health clinic, the sign that's out on the main road, I asked the landlord and she was like, yeah, I don't care. Just put it out there as long as you're not blocking, the view of the, the driveway that comes into it. I was like, okay. So me and my medical assistant went out there. Like we built the sign ourselves. I went to signs.com and I ordered 6x6. I think it was 6x6 or 5x5. Anyway, it was a big sign, metal sign, reflective, so you could see it at night, when the light's striking it. I think the sign cost me like $700. Ordered on signs.com. Like you could sit there and design it yourself on there. They have a little program there. Like I created it. I put my logo in there. I put my phone number, the website, et cetera. I put it all there. Ordered it. Got here, got to my place in like a week, big old giant box. We open it up and then we just got big 4x4s, put concrete in the ground, and we sit there and just nail it up there. It kind of looks like shit, to be honest with you. But you know what? It works. It works. Whatever. You know what I mean? So yeah.
A couple of things. One of the Somebody mentioned to me, you should, you look like a criminal, and that was you need to put on a lab jacket, and this is kind of not the niche of, not the sterile, environment that I'm trying to reach a particular, type of patient population, at least for, that type of niche market. I don't know. What do you think about in terms of, profile picture? Should it be more professional looking or?
No, I think you look fine. You look like a real person.
Okay. Okay.
You're wearing kind of a sporty shirt. You're showing off the guns, like big old smile on your face. Like you look personable. You look healthy. Like that's kind of what you want.
Right. Okay.
Not a single picture of me on the Elite MP website is me in a lab coat. Like majority of pictures I have, I'm wearing a t-shirt. I'm real.
That's right.
So I personally don't think it's that big of a deal. I think as long as you look professional, as long as you got a 5 o'clock shadow and you got crap in your teeth and your hair looks like shit. Like as long as you look presentable, nice, and somewhat professional, I think that's fine.
Okay.
I go to my men's health clinic sometimes to see patients, and I wear jeans, tennis shoes, and an Under Armour gym shirt. My hair is done. I look okay though,
These guys coming to see you, they got problems. You're very disarming. They feel comfortable when you walk in the room. So
100%, they feel comfortable. Like this is just a normal person. This isn't some stuck-up urologist.
Yeah, I see that. Yeah, I agree. Yeah, that's the way it's validated in my mind. So that's good.
Yeah, for sure. I think you're fine. All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all Elite Nurse Practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and that other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode.
Big questions, kind of a bit tangential, but related to the practice. The practice that I'm with now, as far as what I do in the afternoons with hormone optimization. We have 5 compounding pharmacies, all of which pulled out from the compounding of any peptides other than the GLP-1s. I have there's a pharmacy that I just got introduced to here in the North Texas area that has all of the crazy injectable peptides, but any combination of injectable peptide in multiple combinations, they have it all day long. So I talked to the pharmacist there. I said, "What the hell are you doing? I mean, are you worried?" He said, "These peptides are on the watch list. They're not on the ban list. And until the FDA says cease and desist, stop compounding them, we're going to continue to offer them to prescribers." So they're
that's the story with a lot of other compounding pharmacies as well.
Really?
So yeah, there's still a lot of compounding pharmacies out there that are producing these things. As a prescriber, listen, this is my opinion about this. Okay. Let the compounding pharmacies worry about the compounding pharmacy. Okay. Let them worry about being FDA compliant with them and their stupid, rules about not being able to do this. Right. Let's just be real here. The pharmaceutical companies have their hands, in the pockets of the FDA. All right. Pharmaceutical companies don't like these things because it makes patients better. It prevents health problems. It treats and cures certain things, right? They don't like that. Let's just be real here. A lot of it's complete nonsense. I read the FDA statement about, ipamoron or whatever. There's not enough safety data to support this. What are you talking about? Like that ipamorelin was developed by a pharmaceutical company. There's plenty of clinical data. It's been used for years, no problem whatsoever, right? So let the compounding pharmacies worry about the compounding pharmacies. You as the prescriber, it is not illegal to prescribe these things.
That's good. That's
okay. The rules are compounding them, not prescribing them, not using them, compounding them. Well, you're not compounding them, but you're still using them. I don't worry about it. I don't lose it. I don't lose 1 minute of sleep over it. And I take peptides myself. I'm not worried about it.
So, I mean, as far as, the peptides that you offer in your practice, you're still offering, IPA and CJC and Tessa and,
yep.
All the other growth hormone security drugs. So the whole,
yep. Yep. And the thing is too, a lot of them, a lot of them are completely still within reason. Like Sermorelin, they didn't ban that. Tesamorelin, Tesamorelin's FDA approved. It's an actual medication. You prescribe the name brand of it if you want.
Yeah, absolutely. Just pay $100 for a Grifta and there you got it,
Yeah. So, there's still peptide. And even if you want to be 100% compliant and don't want to worry about it, even though it's not illegal, you can still do Sermorelin. You can still do Tesamorelin. You can still do those if you want.
Absolutely. Yeah.
You know what I mean? Yeah. And it's completely fine. You don't have to worry about it. So yeah. So don't worry about it.
Where do you kind of keep your eye on where there would be any cause for concern as a prescriber of these peptides because they're in such demand? Who do you kind of lean on in terms of for us as as prescribers, of these things. There's a pharmacy that I use all the time, in Florida. Your stomping grounds, and two of the pharmacists are on the faculty with the Seeds Institute. I'm sure you heard of William Seeds. He runs that peptide fellowship program. He's an orthopedic surgeon out in California. They said, the FDA, one of the investigators is they're making their rounds in Florida and, telling all the pharmacies to knock that shit off and or they're going to get a second visit. So we got to be real careful, the standard stuff you've been hearing since last year. So, but then you talk to other compounding pharmacies, just like you said, they're like, well, the hell no, we're not going to stop, producing these and make it as long, until we get, a cease and desist notification from the FDA. We're going to offer them all day long to prescribers. So
just throwing this out there real quick, like these compounding pharmacies aren't just being mavericks about this and doing this. They've talked to the lawyers. You know what I mean? The lawyers have pulled apart the statements from the FDA and all this kind of thing. They're not just doing it. Like they have some legal backing.
Oh, yeah. I'm just curious. So, as you continue to prescribe the peptides, which I fully intend to do as well, staying ahead of kind of the legal curve, what would be a notification to you or an alarm sign to you where you're like, okay, I better not write for these particular peptides because it may create a liability, for me as a prescriber. What in your mind is kind of, how you gauge that, that risk?
It doesn't hurt patients and it's not completely banned, right? Like I'm not going to sit here and prescribe someone oxycodone off label to help them breathe. Because like there's a lot of data out there. A lot of patients will say oxycodone, people with COPD, oxycodone helps them breathe better. I'm not going to prescribe that off label for someone to help them breathe. Right. This is not a controlled substance. These are safe substances. Right. I just don't worry about it. I wouldn't do something that was like straight up just illegal to do. Like this isn't a Schedule 1, I wouldn't be prescribing stuff and having it shipped from China or some kind of crazy nonsense like that. Like compounding pharmacies providing it, I'm going to prescribe it. I'm not worried about it because these things show a lot of benefit. I've done them myself. Patients love them. They really, truly help. Like if you're suffering from an injury and you take BPC, like it's amazing.
And in addition to all the other things, non-healing wounds and gastropathies and autoimmunity. And, I use it for all kinds of stuff.
Yeah, it's fantastic.
Yeah. So, all right. Well, that's good. That brings a lot of comfort. I appreciate that, my friend. Yeah. I'll just continue to do what I do. And, I'm sure, I'm sure the compounding pharmacies will call me. I have a good relationship with the pharmacist. I know I've learned one thing, develop good relationships with the pharmacists that take care of you as a prescriber. They kind of
100%. Absolutely. 100%. Any other questions?
Yeah. So, what is your, one of the, I talked to a consultant, one time, it was about a year ago, and he has a real big functional medicine practice. And he said, one of the keys to success of your practice financially is building an email list, send out newsletters and, build a relationship with patients, where you can, foster this stream, of patients and interest in your practice. So, you see on the internet, these services popping up, offering, bundled email packages, where for, $3,000, you can buy 10,000 emails of patients that are interested in hormone optimization or that kind of thing. Is that real or is that kind of a scam?
Buying an email list for a local practice might not be a good idea, because at the end of the day, how do they really know those emails are associated with people locally? Okay. An email. So I would be hesitant of spending money on an email list. Your email list should be something that you organically build. Okay. Your email list should be used to sell additional services to patients, to email them when you have a new product available. Just release tesamorelin, try it out now, first month, $150, take, $50 off or whatever. Okay. Your email list should be used for maximizing revenue from your current patients, your current customers, increasing that lifetime value of that customer. That's what an email list is for.
Okay.
Yeah. Because remember, it's always cheaper to sell more to current customers than getting a new customer.
Okay. Fair enough. Yeah, I remember calling this one service and they said, yeah, we vet the functional medicine kind of space, and we'll send you 10,000 emails, or you can buy it for $2,000. And these are all people that are in that functional medicine space that are interested in the type of services that you provided, and it causes X amount of dollars, and you get these many emails. So, more for the virtual medicine, the online practice. I was just kind of wondering, is that even remotely a good investment? If there's a value to reaching out to people you don't know on a big email list of 10,000 emails of
no,
people.
You probably wouldn't get a single customer from that. Okay. Yeah. Again, and I've said this multiple times, these people are looking for these services. So sending out a blind email to cold customers might not really result in anything. Your goal is just to make it as easy as possible for people to find you. These people already want this service. They read about it online. They talked to a friend about it. They were listening to about it on a podcast or something,
Right.
So make it as easy as possible for them just to find you. If you do that, you're going to have a successful clinic. You're just going to, especially when you're right next to a fitness center. Geez, that has hundreds and hundreds of customers, if not 1,000. I mean, you're sitting on a potential gold mine here.
Yeah.
I mean, you really are. And you said there's really no one doing men's health in your area?
No, I mean, not that I know. I mean, I'm sure there is.
I'm sure.
But, North Texas, Dallas, Rockwall. This gym is in Rockwall, Texas. So I guess if I looked there, I could.
There's probably someone, but there's really not a whole lot of competition. Like I said, you're sitting on a potential gold mine here. So blow it up.
In your thanks, Justin. And in your mind, and the kind of circling back to the functional medicine piece in terms of packages. All right, that's a big deal that I just really don't understand how to make work. I'm sure I'm overthinking it, but offering a package plan, instead of an episodic visit. I remember the same guy that a physician who consults for functional medicine practices. I paid him a gazillion dollars. That was stupid of me to talk to him for 15 minutes. He said, "You're never going to make money in functional medicine and age management medicine by seeing patient to patient, one-off visits, like you in the office. He said, the only way you're going to make money in this business in functional medicine is to sell packages. So if you're going to treat, a person with reflux disease or with high blood pressure or some sort of functional problem, you're going to sell them a package. You're going to tell them it's going to take me 7 months to fix this problem for you, and it's going to cost you X amount of dollars for this package that that I'm going to provide for you.
I tend to agree. Yeah, I mean, I tend to agree with what he said. It's very hard to make money. I mean, you're going to make money, but it's hard to build a business that's going to really be profitable by just billing people per visit.
Right.
Okay. Yeah. You really don't want to bill per visit, per product. The real money for a practice, and especially when it starts building more of a partially passive income stream for you, is to have a membership, to have a subscription. Okay. So he is right there. And I would even go a little bit deeper too, and also include in that membership, in that package, the meds, the supplements, the vitamins, whatever it is that you're going to use. Okay.
Really? Okay.
Yeah. So you got to basically make it as valuable and as convenient as possible. Like if you can create convenient care for people, convenient. Okay. People don't want a job. All right. Convenience, deliver convenient care and also provide value, you're going to win. So convenience is providing them the supplement as well. For this price, $250 a month, I see you once a month for 30 minutes or whatever. It includes the first initial evaluation, that's 1 hour, and it also includes the supplement or the hormone or whatever it is. If you include that in it, it's convenient and it's valuable. Like if I go to a business and I pay him $250 a month, and that also includes the medication, it includes the service, it includes the product. Hell yeah, that's awesome.
Okay.
Yeah.
So that, do you think, that based on, what your cost is, if you're selling, if you're using an FSH and LH mimetic plus an exogenous testosterone, plus or minus an AI, whatever, if it's 2 or 3 medicines in a package at $250 a month, based on what the running, rate is for, like I'm just being hypothetical here, testosterone, HCG, and an AI. Are you generating money off of off of bucks a month?
Oh yeah, you should be. Now I don't know if I'd include HCG in that because HCG is just expensive,
Yeah.
But like our base rate at my men's health clinic, we're charging about $140 a month. Okay, that includes the visits, which I follow up with most patients just once every 6 months. It includes the testosterone, it includes the syringes, the vials, it includes anastrozole if they need it, and it also includes B12 injections. That sounds like a lot for $140 a month. It is, but shit, our margins are still like 110, 120 bucks. Like we're still making a lot of money.
Wow.
Okay. Yeah. So you create the accounts with the compounding pharmacies, you price it all out, you build your membership and your pricing based off of your costs. Okay. And not only just the cost of the physical product of the medication, but also the cost of your time. How much time is involved in this? Is this a very intimate, 1 hour a week intensive program? Well, if it is, you need to make sure you're accounting for your time as well. Men's health, outside of the first hour initial evaluation, most patient follow-ups are 10 minutes. If that. There's some patients it's 5, Like I talk to some of my patients 5 minutes every 6 months. Like they are dialed in. They have no problems. What the hell else are we going to talk about?
You're right.
You know what I mean? So like, yeah, so you got to factor that in as well. Okay. So if you're doing some in-depth functional medicine and, you're going to be talking to this patient an hour every week, how much of an hour, like how much is your time worth? Right? Most nurse practitioners, experienced nurse practitioners. I mean, you've been a nurse practitioner for 20 years. Like, you've pretty much seen it all, That experience is pretty invaluable. So how much is your time worth? How much do you make as a hospitalist hourly? $100 an hour? At your practice, how much are you making? Like at my practice and my businesses, for the amount of time that I put into it, I'm worth $500 an hour. So you got to factor that in.
And so you find that people on these packages, like you said, your standard package is testosterone, B12, and an AI if they need it. You provide them, so many, tablets of an estradiol.
It doesn't cost me anything. You buy a ball of 30 of them for $3 or something. You know what I mean?
And so, and they do, and this would also include supplies. So you think, you think 250 is, overshooting? I got to tell you how many people that come to liking the practice that I'm with now, because I just talked to a guy the other day that, some of these, people are charging him, these guys are being charged $750 every 2 months for just testosterone and an aromatase inhibitor. And people are doing this. They're paying this kind of money for just.
I know it's ridiculous. Like, if you can sleep good at night ripping people off, then good for you. But yeah, I know these people who do this luxury pricing crap charge patients $1,000 a month for semaglutide. Like, come on, get lost. You're just ripping people off.
Absolutely. What would you say is a reasonable cost for the GLP-1s, like for semaglutide or tirzepatide?
If you can get away with not spending more than $150 a month on the actual medication, and you're charging $300 to $400 a month for the service and the med, then you're doing pretty good. At the end of the day, man, you got to make sure you're making between $100 to $150 profit a month off each patient. Minimum.
Okay.
But that's also factoring in your time. If you're spending an hour with the patient once a week, 4 hours a month, then I'm only making $100, $150 profit. That's not worth your damn time. You're making $25 an hour, So you really got to factor in when you're building your membership here, not only factoring in your costs, but factoring your time here. I can't emphasize that more. Like, that's so important.
Okay. Yeah.
So be thinking about that with this functional medicine stuff. Functional medicine in your patient, it's time consuming.
Absolutely.
So yeah, it's time consuming. So you really need to factor that in. That's why a lot of functional medicine clinics are expensive.
Of course. An evaluation could be $1,000 with all the functional medicine testing and the evaluation. It's labor intensive, and people are paying for it.
People pay for it. Yeah. I know a nurse practitioner who has a functional medicine practice. Her initial evaluation with the patient takes 2 hours.
Yeah.
That's 2 hours of your time. How much are you worth? You're worth at least $100 an hour. So you better account for that. So I can't stress that enough. So I can't really give you exact pricing here because it really just depends on what it is that you're doing. So just keep it in the back of your mind that you're making at least a minimum of $100 to $150 a month in profit per patient. And that's for the patients that are only taking 15 minutes of your time. Okay. If that.
Yeah. That sounds good. The owner of this one practice that I'm, with, when we first introduced the GLP-1s, he charged patients a membership fee, like you mentioned, $5.99 a month. They got all the consultations, all the GLP-1 medicine they needed, depending on how the dosage was changed, and labs. And there's a waiting list to get into that program. So he's making. But I don't think I'd feel comfortable charging that much.
Well, you can charge that much if you're providing nutritional advice, exercise advice. Like if you're really, really increasing the value of it, you can charge that. But if you're just going to talk to the patient 15 minutes a month, hey, this is your weight, great. This is your semaglutide, cool, everything looks good. Then it might be hard to justify that kind of cost. So it really just depends on the value that you're putting into it. That's what it comes down to.
Okay. Yeah, that makes sense.
Yeah. Like I signed up for this consultation thing about 6 months ago. It was like this, it was more like a personal empowerment growth kind of a thing. Like I'm at a part in my life where I'm trying to find a little bit more purpose. Maslow's hierarchy of needs, I feel like I'm at the very top, right? Trying to come to that self-realization sort of a thing. And so I found this thing. It was $10,000 for a 3-month kind of boot camp thing. And so I was like, okay, I'm going to try this out. This sounds pretty good. I'm not going to say what it was. But I do it. And after a week, I'm like, these people are out of their mind if they think I'm going to pay them $10,000 for this. I was like, I want a refund. There's not value in this. What do you do? $10,000. Get out of here. There's not enough value here to justify that. I want my money back. It was complete crap. Just keep that in mind.
Okay. Oh, this is that's golden information, man. Thanks so much for that. I'll probably have more questions for you, but I'll email them to maybe we can.
Yeah, shoot me an email. Let's do a follow up. Open up, give it a couple months. Shoot me an email. Let's do a follow up and see how you're doing.
I will. Any take home points for the virtual practice? Because I'm really this one goes live in 2 weeks, and then I'm working on that brick and mortar in the next.
Don't expect a whole lot to happen unless you're marketing the hell out of it, okay? Because no one knows you're going to exist. All right. So don't expect a whole lot to happen. Go in this with realistic expectations. You probably won't have very many patients, if any. Once you open that brick and mortar up, though, that's when it'll blow up. So your telemedicine component should mostly be probably follow-ups, but because most people are going to see your place and it's going to be more of a brick and mortar thing, it's going to be more of a hybrid practice. Okay. So don't expect much from it unless you're willing to spend the money marketing it, which in my opinion, I don't think you're going to need to do that once you get that brick and mortar open and you start doing that.
Okay. That sounds good. And, in terms of, other services to offer, in the practice, medical aesthetics, Botox, derma fillers, PRP stem cells, the IV nutrition, that kind of thing in the brick and mortar location. Do you see those as real valuable money owners or money makers once the practice gets, up and running?
Yeah, it can be, but a lot of aesthetics has really slim margins. So I don't think I'd worry too much about that. I think you're going to make most of your money off this weight loss, hormone replacement therapy, and this integrative medicine, functional medicine. I really don't think you're going to need to do that.
Okay.
If you're going to offer any kind of service at all additional to this, do some vitamin injections. Don't do infusions. Do injections, NAD injections, glutathione injections, alpha lipoic acid, B complex, things like that.
Okay.
Yeah. So
I'm wondering if that can be built into, the program.
100%. Why couldn't you?
Okay.
Yeah. So, all right. Well, listen, I like to end the episode with you asking me a question, personal question or a curiosity. Do you have a question or a curiosity for me?
You should have given me time, man, to think about that.
Oh, you've listened to podcasts before. Come on, you should be ready. If you don't, no big deal.
So you're I mean, where are you at now when in your practice? Are you just doing are you still is this your primary focus?
Elite NP is my primary focus right now. Yes.
Not your actual practice, your medical practice, but it's the educational part, the Elite NP.
Correct. For the most part, Elite NP is my main focus. Yeah. And my men's health clinic, but honestly, I don't do a whole lot of it anymore, just because I have other people that do it for me. So I don't really have to do a whole lot. So
that's good. Is it real? The earning potential of 30, 40, 50 grand a month. Is that really still possible in today's climate with these type of services?
Absolutely, if not more, still possible.
Okay, and thank you so much. Last question as I leave, that is, are you going to be putting any more courses in that functional medicine course? Any more modules? Your stuff is great.
Yeah, we actually, So the functional medicine lab course, we recorded this end of March, early April. So the functional medicine lab course is literally coming out in like 2 weeks. Once that is done, our main functional medicine line of courses is going to be complete. And then we're going to have this big package where we're going to have all of them, and we're going to have like a certification exam, that kind of stuff. So we're really trying to pivot to open up more of like an NP focused functional medicine school. So lots of exciting stuff happening with that over the next year. So just keep your eyes out.
Yeah, I think that's great. I've been through big programs, A4M, IFM. They're wonderful programs. Spent a fortune going through them, but still a lot of people graduate from those big programs, having a lot of questions and actually what to do for the sick as shit patient that shows up at 8 o'clock in the morning, and you want to treat them from a functional medicine perspective. How do you put all that stuff together? So the way that you are delivering this material in a real practical way is truly invaluable. And I'm sure you're going to gain a lot of customers, clinicians who have graduated from those big programs that still are like, man, I spent $25,000 in that functional medicine.
Right. But I still don't know what the hell's going on. Yeah, I've heard that so many times. So, yeah. All right. Well, cool deal, man. Well, listen, I appreciate your time. Shoot me an email if you want to do a follow-up, okay?
Yeah, I will, certainly. Thanks again, man.
Awesome. All right. Take care. Bye. I hope everyone enjoyed the episode with Nick. It sounds like he has a great opportunity in front of him. I mean, he's opening up, right next to a very busy gym. It sounds like it was already a medical practice before. So it sounds like he's got a real win here. I think one of the big takeaways here is that try to focus on free marketing. Like, I don't want him to spend a lot of money marketing his services when he doesn't need to, Marketing to cold leads on Facebook or whatever usually is not that great. It can work, and in some circumstances it works really, really good. But overall, I would say utilize what you can for free. That's your Google business listing. That's getting word of mouth out. That's getting a sign out there, those sorts of things. So utilize the free marketing that you can, because he's probably going to be able to build a pretty successful practice and not spend much on marketing at all. All right, hope everyone enjoys this episode. Talk to you guys later. Thanks. Bye. Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and/or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcasts. The content in this podcast is copyrighted by Galaxy Medical Southwest 2023 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.